A lot of people suffer from high blood pressure, and I've heard you speak many times on this. High blood pressure is a simple lack of calcium. Can you explain how high blood pressure is one of the symptoms for lack of calcium?
Sure. Well, again, we have to appreciate that our vascular system is a closed system. In other words, not water flowing in, water flowing out. There's a fixed amount of fluid going around within a closed system of blood vessels. And like any hydraulic system, if you want the bucket to go up, you have to increase the pressure in the system, which means that you have to make the system smaller, because the volume of fluid is not going to change. So you have to make the system smaller, which means the pressure goes up, and then with that piston, the bucket will come up. Well, the same thing is true in our bodies. Calcium does many things, including help the muscles relax. When you get cramps in your muscles, it's because you can lack calcium, and you take the calcium, muscles relax. Sometimes it can be magnesium, but most often it's calcium deficiency. The same thing is true in the muscles and the walls of your arteries. When you don't have enough calcium, they constrict, they contract, because they're having cramps in the muscles. And of course, you're closing the system down. You're making the system smaller, same amount of volume of fluid, so the pressure goes up.
I see.
Another thing that happens when you have high blood pressure is you can have kidney issues. And usually there's nothing wrong with the kidney, but again, there's obstructive artery disease. The dirty blood's not getting to the filtering units in the kidney. And the kidney doesn't like that. And so it releases a hormone called renin, R-E-N-I-N, which drives your blood pressure up, hoping to drive more blood into the kidneys.
I see.
And so both of those are resolvable very quickly with supplementation of the 90 essential nutrients. And in the case of renin being released, it's a kind of an expensive test to run, so it's very simple to deal with it. You just take the supplements along with the 90 that will actually increase blood flow through obstructed arteries in the kidneys and dilate the arteries very quickly. And then when you dilate the arteries very quickly, pressure goes down, and the renin production stops.
Is there any symptoms that we can determine if our renin is above normal? Like
well, yeah, there's a blood test.
Color the urine, would that?
No, it really won't. It's a blood test, unfortunately. So that's one where you have to go in and get a blood test. But again, if you do a urine test and you have protein coming through in your urine, this tells you that there's something going on in the kidneys. Almost always it's a vascular problem. And again, it has to do with obstructed arteries. The blood flow is diminished. Can't get the dirty blood into the filtering units, releases renin, pressure goes up. And you can also have a calcium deficiency at the same time.
Absolutely.
And this is where people get, what they call malignant hypertension, where even medication won't help, because the medication is designed to deal with blood pressure caused by nutritional deficiencies, the medication is, as opposed to the hormone. And so the people don't respond, if it's a renin, they don't respond very well to medication.
Now, with the basic 90 and additional with calcium to body weight, which essentially will help with that, because you talk about the lack of calcium causes muscle cramps. And muscle cramps can happen not only in your legs. So if somebody is experiencing muscle cramps in the legs, you might have the early warning signs of pre-high blood pressure symptoms.
Could. You could also have degenerative disc disease. And there's pressure being put on the sciatic nerves. This is what happens in restless leg syndrome, where you're okay as long as you're vertical, maybe even sitting against a firm back chair, fine. Standing up, walking, no problem. But when you lay down at night, the curvature in your back goes away, it flattens out. And if you have degenerative disc disease, it pinches the roots of the spinal nerves, the sciatic nerves in the lumbar area, going down the legs. And you feel like there's creepy crawlies in your legs, and your legs will jerk around involuntarily. You're not doing it. Your legs are just kicking around. You might get cramps in your legs.
Talk about high blood pressure. I mean, what is normal range for somebody's blood pressure?
Normal blood pressure, I like to see somebody like 110, 112 over 70 something. Mine runs 90 over 60. And this is because I've been taking the 90 twice a day for 69 years now. I avoid all the bad stuff, all the inflammatory things consciously. I mean, very proactively. I drive waiters crazy in restaurants, making sure I don't get any inflammatory things. And so people say, you got to be on medication. Nobody has your age certainly has a blood pressure of 90/60. Well, it can be done if you avoid all the bad stuff, you take in all your required 90 essential nutrients according to your body weight, and there's no reason why it can't be done. It's just you have to be obsessive about it.
Sure.
But anything under 120 over 75 would be reasonable. Yeah, you get 130, 135 over, say, 90, you're getting into the early stages of hypertension, high blood pressure.
Now, would you explain to people what the top number and the bottom number means? Typically, when they give you a blood pressure, they say the top number is higher and the bottom number is lower. Can you explain what they're talking about there?
Yes. The upper number has to do with the contraction of the heart because it's making the space in your circulatory system smaller.
Okay.
Okay, so the heart contracts, okay, puts pressure on the fluid, the blood in the chambers of the heart. And so this is the top number. The lower number, the heart's relaxed, and so the space is bigger,
Okay.
so the pressure is going to be lower.
Okay. So it's the top number that we're concerned about.
Oh, we're both.
We're both.
Oh, absolutely. Because if your lower number, instead of being 75, is 90, there's something going on.
So what is the range for the lower number? What high, low, what are we looking at when it gets too high for the lower number?
Well, I like people to be below, on the lower number, below 75.
Below 75?
And the upper number below 125.
Okay. If somebody's on high blood pressure medication and they start supplementing with the basic 90 nutrients to body weight, and they have a problem with a doctor, with conflict with the doctor as far as medication and nutrition, because we do know that nutrition enhances, a lot of times enhances the medication. So what kind of advice can you give a client or patient that's taken high blood pressure medication and wants to supplement and wants to get off the high blood pressure medication? How would they work that in with their nutritional protocol?
Okay. Well, basically, Marvin, what happens is when you want to get off your medication and you want to do the nutritional part, which is the appropriate thing to do, you have some responsibility. And this means you have to take your blood pressure. I take my blood pressure twice a day, once in the morning, sometime, same time every day, like halfway between breakfast and lunch. And then I also take it maybe an hour before dinner time or 2 hours after dinner, same time every day. Keep a little logbook. And as your blood pressure begins to drop on the nutrition thing, you can begin to reduce your medication, your blood pressure medication, by say 10%. Nothing dramatic. You can't cold turkey off of it. You're on maybe 2, 3 blood pressure medication. You have to work on one at a time.
Right.
And if a person's concerned about that, they can go visit their doctor and let their doctor do it. But if they've been taking their blood pressure for some time and they're very confident that their numbers are going to be accurate, you can do it yourself because you're monitoring your blood pressure. It's not like you're doing it blindly.
Right.
As your blood pressure is slowly dropping, you can slowly reduce your medication. And so there's nothing wrong with that. And so this is something people can take responsibility. The book, Let's Play Doctor, teaches you the normal blood pressures and how to wean off of any medication. When you have high blood pressure, you can take responsibility because you can monitor your own blood pressure. When you have blood sugar issues, diabetes,
Right.
you can monitor your own blood sugar issues so you can reduce your medication gradually, no cold turkey stuff. Same thing with pain. If you're on pain medication and your pain begins to go away, you can begin to reduce your pain medication gradually. And so there's some areas where you need to, for instance, go back to the doctor before you lower your medication.
Sure.
For instance, glaucoma,
Right.
where you get pressure in the eye. I wouldn't reduce the number of drops I'm taking to keep the pressure down without doing it based on the numbers. Same thing with blood thinners. If you're on blood thinners, I would definitely go to the doctor and have a test done.
Sure.
And reduce the medication based on numbers.
Right. And is there any specific symptoms that they can be aware of that they might be getting the category of high blood pressure before with actual testing?
Well, they can do their own testing. You go in, if they don't have an instrument themselves, they can go into one of these pharmacies and have the chair, put your arm in there, push the button, and it takes your blood pressure. And so you don't need to go to a doctor to get your blood pressure taken.
Right.
Okay. Any family should have one in the house, and everybody needs to know how to do it.
I guess my question.
Headaches, maybe
Yeah.
headaches, nosebleeds.
Okay, so headaches and nosebleeds would be kind of a symptom. Could be some symptoms that would indicate that we have an elevated blood pressure.
That's possible.
Okay.
Yeah. Again, blood pressure is something you're in control of because you can take your own blood pressure. You do not
Sure.
need to go to the doctor
Sure.
and have your blood pressure taken, as opposed to having to go to the eye doctor to get the pressure inside your eye taken before you reduce your
Right.
drops numbers for glaucoma, because you don't have the ability to test the pressure in your eye.
Sure. Now you brought up a real good contrast here. glaucoma in the eyes is the same as high blood pressure in the cardiovascular system. And essentially, is the same medication they use for that?
No, it's drops. They put the drops in the eyes as opposed to an oral medication.
Okay.
And the drops in the eyes will, in fact, reduce the pressure in the eye.
Okay. Now, when
Relieve the symptoms. The disease is going to continue getting worse because you haven't dealt with the problem.
right,
One of the crazy things about high blood pressure is that the medical system has enslaved the black community, telling them that it's a genetic disease in the black population. It's absolutely not true. High blood pressure in the black community is caused by the same thing that causes high blood pressure in the white community, or Native Americans, or Asians, or Latins. Mineral deficiencies and renin being released from the kidney. Those are the two things, 99.9% of the time, that will cause high blood pressure. Resolve those problems, blood pressure comes right down. And again, realize that every century over the last 5,000 years, there's thousands of failed medical theories. In the 20th century and 21st century are no different. And just because a doctor says high blood pressure is genetic in the black community doesn't mean it's true. It's not true.
Right.
It's one of those failed medical theories.
Right.
And so nobody in any racial group should suffer from high blood pressure longer than a couple of months.
Now, is high blood pressure common amongst children as well?
It can be. Again, it has to do with inflammation causing obstructive artery disease, so that this system
Right.
is getting smaller, same amount of fluid,
Sure.
and can be mineral deficiencies, okay? And age has nothing to do with it. Now, babies can be born with high blood pressure because the mother was deficient while the embryo was forming. Okay? And so doctors, again, have this naive belief, the failed theory, the blood pressure either has to do with genetics and race or age, weight. That's not true.